Hello, I'm Christina Davis, Director of the Program on U.S.-Japan Relations. Today, we welcome you to listen to our seminar discussion and join us to talk about why has East Asian COVID model diverged over Delta and Omicron. This is a great opportunity to welcome you to the new year with the Program on U.S.-Japan Relations. We have an exciting seminar series ahead, starting today, and we will be addressing many of the pressing public policy problems and intellectual questions about US-Japan relations and East Asia. Today, we will think about the challenge of a global pandemic, which offers us a laboratory of different government responses to the same crisis. One might think that disease does not recognize borders. However, the huge disparity in health outcomes across countries has highlighted that social conditions and policy choices matter. It is essential that we learn from different approaches through comparative political analysis. And we're very fortunate to have with us today a leading scholar who has been taking on this important research. So I'm very pleased to introduce to you our speaker, Yves Tiberghien, who is the Professor of Political Science and co-director of the Center for Japanese Research at the University of British Columbia. He also spent some time at Harvard at the WCFIA when he was a Harvard Academy Scholar, which makes up for the fact that he once said no to a Harvard Business School offer to work for us. But he's very happily working hard at the University of British Columbia. He is a prominent scholar on comparative political economy and global governance, where he studies both East Asia and Europe and has published several books, including Entrepreneurial States, Reforming Corporate Governance in France, Japan, and Korea. He's also written an edited volume on leadership and global institution building. And today, we will hear about his research that is extending on his most recent book, The East Asian COVID-19 Paradox, which was published by Cambridge University Press in its Elements in Politics and Society series just last year in 2021. The seminar today is part of the special series on policy innovations and crises supported by a grant from the Japan Foundation Center for Global Partnership. It is co-sponsored by the Fairbanks Center for Chinese Studies and the Takemi Program of International Health of the Harvard T.H. Chan School of Public Health. I'd also like to announce our next event for Monday, next week, when we will discuss the global common stewardship, the world and systemic change, with Naoko Ishii of the Center for Global Commons, the University of Tokyo. Please note, in order to coordinate with a seminar event with a speaker in Tokyo, we will be hosting in the evening Boston time from 8 to 9 p.m. We hope you may join us next week. Please remember our Zoom etiquette. And now I would like to begin. Thank you so much, Yves, for coming to share your research with us. It's really great to have a comparative perspective on the current crisis today.
Thank you very much, Christina, for this kind introduction. And thank you, Shin, for having me. It's a great pleasure being back, after attending the events of the US-Japan program back when I was a Harvard Academy Scholar. Always with great pleasure, great stimulation, and great discussions. So I'm going to start sharing my screen. I'll also start by noting that I'm joining you from the traditional, ancestral, and unceded territory of the Hosanich people. I want to start by acknowledging the enormous toll, death, and pain of so many around us since December 2019, and the mental health impact and loss of freedom and vision for so many of us, especially young people and students. We're exactly now 2 years into the bigger part of the crisis. I will also note with some humility that this is a moving target, right? So studying COVID policy is hard and it keeps changing with each phase. And so obviously this is a work in progress and there will be limits in my presentation. So this is the little book. So there are a couple puzzles on the governance of COVID. First, there's a global puzzle about why a pandemic of limited mortality trigger this greatest simultaneous lockdown and deepest short-term economic recession since the Spanish flu. I won't say as much on this. This is covered in the book. Today, I'll focus more on the second and third question. Why did East Asian and Oceanian countries, on average, manage to limit mortality and economic damage better than the rest of the world in 2020 across diverse regime types? And within that comparison and the emerging sort of East Asian model, how did Japan fare? And Japan actually took a path of its own, which is interesting. Third is, why did East Asia and Oceania show divergent path in 2021 and 2022 under the Delta and Omicron variants? And what are long-term implications? So key points I will emphasize in this talk is first, that there is a multi-level global crisis here, not just a health crisis. So I'll be talking about society and economy as well. And all this is happening at a timing of difficult global coordination due to the US-China confrontation. And in 2020, the US reluctance with global institutions. So that's the context. At the national level, I argue in the book and in this talk that two variables were essential in explaining performance of the East Asian cases. First, institutional capacity, and I'll get down to 8 subcategories of that. And second, social resilience. So I'll be talking a little bit about outcomes, the dependent variable, and then I'll talk about the 3 phases, and especially in the phase 1, emphasize causality, explaining East Asian outcomes. And then we'll see the differences during Delta and Omicron. What we can see so far with Omicron. The Omicron phase is noteworthy for its loopback effects. There's a lot of loopback effects from what happened in earlier phases. So it's totally not an independent moment. I want to give thanks to great research assistants I have been able to work with in the different cases, and the support from different centers at UBC, but also Sciences Po and Todai, where I teach a class on global governance. So measuring national outcomes, especially in the case of a moving target and a multi-dimensional crisis like this, is difficult. We can measure health outcomes. And here in the book and today, I focus more on deaths per million rather than cases, because cases are moving a lot. They are not very stable. And also, they depend highly on testing intensity, which, for example, is low in Japan. And so you always have underestimations. We can also measure hospital robustness, which I don't do too much here, but this is the indicators for that. Then we can measure economic outcomes, because there is always that tension between health and economic outcomes. We can measure social outcomes. We start to have interesting reports from World Bank and others and ADB on issues of inequality and issue of social tensions. But so far, we have aggregate data rather than very fine-tuned data at the level of countries. So it's early to get all this. We can measure protest as well. There's this Carnegie protest tracker, including a COVID-19 category. And then we can measure human outcomes in terms of human rights and freedoms. In 2020, in phase 1, there was this whole debate on whether there was a trade-off between health and economy, which was a very strong debate in the US, for example. And here is a graph from the Nikkei, which corroborates what I have in the book, where it was shown that in 2020, at least, there was a pretty strong correlation between low deaths, so high health performance, and robustness of the economy. So there was not a trade-off in that first phase. The trade-off became stronger, however, in Delta and Omicron. So this is the summary of outcomes. This is a simple summary looking at 3 points. 1 year after the crisis, I take February 6, 2021. This is what's in the book as well. This is after year 1 or COVID classic. Then we have September at the end of the Delta phase. And then we have today or yesterday at the end of Omicron. And this is deaths per million. Again, there is imperfection about this. It's undercounted. We know that there is excess mortality in many countries, but it's still more robust than anything else we have. So what we find is South American countries, North America, and Europe in general have had the worst outcomes, which is very surprising, and I will say why. Based on what we expected before the pandemic, they're all above the average. Canada, however, better than the US by quite a bit. The world average you can see in blue. And then all the East Asian cases except Malaysia. Malaysia in 2020 was doing great, but not on the Delta. All the East Asian cases are below world average. And then we have cases like Vietnam, Thailand, and Mongolia that actually did great in 2020, were seen as models, actually beating all the advanced economies, but then succumbing to Delta. We then have a cluster of countries, Korea, Taiwan, New Zealand, China, doing very well throughout. Korea now, with the living with COVID, finally having a pretty big increase along with Australia. Singapore, same story, very, very strong results, but then some opening during Omicron. And then Japan was, compared to the other East Asian cases, was doing a bit less well, but compared to G7 OECD countries, doing much better, of course. And then under Omicron, here we find very little increase in mortality and very, very strong measures, while most of the other East Asian cases a bit more the reverse. They have a bit of an increase in mortality, but less tough measures. So we'll discuss that in a context. This is vaccination rankings. East Asian cases were slow. No East Asian country was able to invent an mRNA vaccine. Only China, Vietnam, and Taiwan were able to develop their own vaccines, but they were not mRNA. But once after the delay of several months, they then picked up, and now the East Asian cases are near the top of the ranking. You find Singapore very high, China, Japan is now very high, 79% double vax, 80% otherwise. And then most even others like Thailand and India coming up very strongly. That's the economic outcomes. And there are two big takeaways here. The first is that on average, the OECD, the G7 economies, if we combine 2020 and 2021, or roughly coming back to, at the end of 2021 to where they were. So they kind of absorbed back in 2021, the 2020 shock. Some of them are still below, and that includes Japan. Japan is still below and will take the whole 2022 or more to catch up with what it lost in the pandemic. And so those G7 countries relative to countries like India, but also China, Korea, and Taiwan, and even Indonesia have done less well. So there's a bit more emerging economy pickup. And then we find that Korea, Taiwan, and China have relatively done better than Japan. So in terms of the regional comparison, we find that Japan will take longer to come back, especially relative to Korea. So Korea, interestingly enough, there starts to be a whole debate on its GDP per capita, but by some measures, for example, Richard Katz, Korea GDP per capita is reaching the level of Japan. By other measures, it's still short by a few $1,000s. So, we see that Korea, Taiwan have done well relatively in the region by this economic standard. For China, something interesting relative to the US is that the GDP ratio between China and the US went from 67% in 2019 to 70% in 2020, and looks like, based on preliminary data, is going to reach 79%, almost 80% by the end of 2021. So the pandemic has had this differential economic impact here. Now, granted, part of that is renminbi appreciation. Now, the average has appreciated by 7%, 2021 versus 2020. All right, so now causality. So to show how puzzling the numbers I presented are, it's important to look back at what we expected. And this is a good thing for social sciences here, because there was an index developed by Johns Hopkins University and the Economist Intelligence Unit called the Global Health Security Index, which was a ranking of pandemic preparedness. And this was done, quite systematically with a lot of sub-indicators, etc. US was on top, UK second, then you find Australia, Netherlands, Canada. Thailand was high, Korea high. Japan was scored lower. It's somewhere in there, which was interesting. But so that's what they had. And then this is, if you tabulate, at the end of year one, so here I did it in based on year one, phase one, February 6, 2021 data. And I grouped them in three categories for the death rate and the GHS index based on, distribution. And then you can then pick the expected performers and the super underperformers, the super achievers. So on the achiever side, those who did much better than their index for phase one, Mongolia, Vietnam, China only after January 23rd, African countries in general, and then Pakistan, Bangladesh, so South Asia. And then you have the super underperformers, most of Europe and US, UK. And then you have those that were expected high performers, that is where mortality in a way matched the expectation of the index. And that's Thailand, Korea, Malaysia, Japan is here, and Australia. So that's, rarely when you talk to some of the crafters of the index, they say, we got it so wrong, we have to go back. Rarely has a scientific, index gone so wrong in real world, right? And so the arguments I make in the book for phase one, at least to explain good performance in those East Asian cases, is number one, institutional capacity with some specific governance structures for pandemic response that are below the regime type and above the healthcare system. So the mid-level institutional tools. And then second, social cohesion and social trust. And again, weak point on the mRNA. But so the 8 subcategories I have, and in a way we could call this the Taiwan, Korea, Singapore model. Number one is the legal tools for pandemic response. That is having good laws on the book that enable the central government to take all kinds of actions, from quarantine to acceleration of PPE supply, testing supply, and even contact tracing tools. All this was on the books for those places, Korea, Taiwan, Singapore, even Thailand. Second, a centralized government pandemic headquarters, which with the power to order all the ministries and all the ministers. So ministers at the table with the prime minister. That's Taiwan, Singapore, Korea, but not Japan. Reliance on empowered CDCs and health scientists in a centralized way with no politicization. Very strong, but less in Japan. There was politicization between the governor of Tokyo and the prime minister initially in 2020. Rapid border response with quarantine, isolation, and staff. Japan was slow back in 2020. Now Japan is the reverse. It's very strong, or over responding, but at the time was slow to do it. Rapid provision of test and PPE mask with centralized push from the government. Korea, Taiwan come into mind, especially. And then contact tracing apps with varying degrees of privacy protection. High in Taiwan, because it was thoughtfully done with legal protections. To some extent, Singapore, despite an authoritarian regime. Medium in Korea, and low in China. And of course, not widely used in Japan with a lot of concerns for privacy. Rapid generalized mask wearing across the region and social distancing. So on this one, Japan is a yes. And clear, precise, empowering, respectful, effective communication. Here, Japan is a partial yes. So what we find here is Japan is the last 2 out of 8, right? And so Japan doesn't fit this East Asian model. And that's part of the story here. And you can see in terms of centralized headquarter task force with all the power I listed, you find Korea triggering this January 22nd, Mongolia January 19, Taiwan January 20, and Singapore January 22nd. New Zealand was not far behind. Australia came later. Vietnam was early, January 30th. But Japan had this advisory committee, and I'll talk more about it, but without the sort of executive power initially in January, and only some kind of loser task force after the law was changed in March. In terms of mask wearing, we find it high everywhere. This is measured as of May, so Japan is there. And in terms of the decision-making based on science, we find it everywhere, a little more disputed in Japan. So those are some of the features. So China, it's important to remember there are really different phases about China. I won't say too much now, but can come back to it. There was a phase of political suppression, then a phase of massive mobilization of health capacity and party cells, where China started to fit the East Asian model I described. And then we have now a phase of political entrenchment of zero COVID and border closure with ever-growing cost. And so that's kind of a new phase where it's of entrenchment. Japan had, of course, the strongest healthcare system in Asia, but with limits on hospital beds and too much rigidity, low empowerment of nurses, low empowerment of young doctors, etc. But only 2 out of 8 of the features I described. The law allowing prefectural emergencies and not even national emergencies was only passed in March, not prepared beforehand. There's still no legal strong lockdown capacity. And then the response initially was hampered by concerns by the Olympics, which really dominated decision-making. There is, on the positive side, a strong focus on privacy, and the COVID-19 task force under the PM lacks muscle. There was, according to Dr. Oshitani, one of the government advisors, who did this very interesting op-ed in the New York Times this week, innovative retrospective contact tracing after the early discoveries from the Diamond Princess ship, and the innovative 3C guidelines, which worked very well in 2020. Japan ends up doing well in the scoring because of 2 assets. Number one, strong social cohesion and a social response to the guidelines through existing social structures. And number 2, very effective protection of long-term care senior homes by the MHLW with rapid closure to the outside. And Margaret Esteves Abe has done a great work on this. The National Coronavirus Response Headquarters was essentially advisory and weak with high-ranking bureaucrats, very different from what we have in East Asian cases I described. And so that led to the critique that we heard in the seminar from Dr. Keiji Shibuya in October, where he said, Japan was focusing on behavioral change rather than quarantine and lockdown, the way the other East Asian cases were doing. The good outcomes in phase 1 were due to people's voluntary response, but it put a burden on them. Testing was always too low. Vaccination was delayed by months due to bureaucratic procedures, structural weakness of the vaccine industry that's subsidized and inefficient, and overconfidence. Too many patients died at home due to rigidities in hospitals and lobbies of hospital managers. And there was a lack of a strong CDC. So that's what we heard. And indeed, if you measure the stringency index throughout the period, we find that Japan in general had a lower stringency index. That's the Our World in Data from Oxford. And so that's one moment here, January 30. Well, this moment is right now. So we find on average, Japan is at 0.47. And it's lower than many East Asian countries and North American. So that's tracked over time. And we find that Japan is the green line here under. So consistently lower stringency measures compared to both East Asian cases and G7 cases. That sounds cool. Closure here, I took one snapshot, December 2020. We find all of East Asia here closed except for Thailand and Australia, but and Japan is open, right? So we find a lot of, if we track those things over time, we find mismatch. So now in terms of causality, second variable, social cohesion. So here are some simple indicators. I mean, there is room for doing much more systematic work, but taking from the World Value Survey, Trust Your Neighborhood, that is a low level measure of horizontal trust your neighborhood fully and somewhat. We find that East Asian cases and Nordic cases come on top. And by the way, Nordic cases also did the best on COVID in Europe. UK here, surprisingly high. And then we find China, Taiwan, South Korea. Japan ends up being lower. But my own thought on this is that those surveys are hard to do in Japan. People, there's some issue of translation and culture in answering questions like that. In practice, it's probably higher. That's the measurement of vertical trust, which is I emphasize less, but it was emphasized by WHO and others. And here we find Japan very low, along with US and France, for example, but not as low as South America and Italy. And in contrast, now, of course, China and Vietnam, we can doubt whether this is trustworthy, but you find in general, the East Asian cases, South Korea, Taiwan, higher, and even Indonesia and the like. Now, after COVID, when we ask about social divisions, do you have a sense that there's more social divisions caused by COVID? Interestingly enough, we find that Japan and South Korea have a high response about yes, more division. So Japan comes out more divided along with South Korea, while most of East Asia, the other cases here, come out less divided, or at least they don't feel there's more division. And of course, US and Europe are more divided. That's a Pew survey. Now, Delta shock. What's interesting is the countries have diverged. So we find that China, Hong Kong, New Zealand, Taiwan, to some extent Vietnam, have kept to zero COVID-19 or elimination strategy, while a second group with South Korea, Singapore, and now Australia have moved away from it because the cost was too high, and they do containment, strategic adaptation, and targeted opening or living with COVID. And now we find those cases during Omicron actually having an increase in deaths and cases. Japan is the third approach with low government controls, limiting contact tracing, high reliance on voluntary social restrictions. So that continued in a way during Delta, but then it correlated with high frustration by the public. This is Japan and Delta and Omicron. What we find is that the timing was terrible for Suga, essentially. We find that the new cases peak on August 25, and when he makes his decision not to run is September 3rd, the cases are still high, but then they decline very quickly afterwards in September. And by the time Prime Minister Kishida comes in, the cases have gone down, and they never came back until Omicron. And meanwhile, vaccination launched by Kono Taro worked very well, and all that happened in August, September, essentially, and October, and so Japan was catching up very fast. Just a little too late for Suga and for the Olympics, but very effective nonetheless. And then we get to Omicron, where we find numbers are even worse, right? Cases per million, they have now been increasing fast, and Japan is slow on booster but highly vaxxed. So that's the overall data. The Kishida response has been on Omicron has been a divergence, right, from previous response under Abe and Suga, robust with assumption of worst case scenario, rapid response, commitment to increase hospital beds dedicated, and a commitment to strengthen the testing regime. But of course, the legal tools are still not there, and so the stringency remains not as high as some other countries. What we find instead is a very strong action on the border. So a lot of the strength has gone on closing the border, and Japan is the only country, along with China and New Zealand now, in shutting down the border to most foreigners. I'll skip this because I'm down to 5 minutes. Southeast Asia, meanwhile, saw a divergence as well. There was one group where essentially the measures were overwhelmed due to social and economic pressures and cultural pressures. So Malaysia, Thailand, Myanmar, Mongolia, and political unrest. And then we find Indonesia and Philippines, where essentially they continued what they were doing, which had its limits, and they couldn't do as well as others, and yet they didn't have a breakdown either. So they're kind of steady as she goes. Omicron, what is fascinating, and it would take some interesting modeling, we find very complex look-back effects between social cohesion, economic pain, and political response to that, and public opinion. So in Korea, Australia, Singapore, there is partial openness living with COVID because essentially the public and the government are fed up with the economic costs. And so they try to contain it, but they're done with zero COVID. Taiwan, New Zealand, and maybe Hong Kong are continuing zero COVID. So far, the costs are manageable, but the pressures are mounting. We find especially Hong Kong and New Zealand. And then, of course, China, but I'll get down to China next. For Japan, the paradox is we find a more robust response than to previous phases and a very tough border closure, despite almost flat deaths. And there's high public support for those stronger measures. So clearly, this is a response to the frustration in response to previous phases. And in China, very harsh enforcement of zero COVID with no exit strategy and real economy costs. So essentially what I'm guessing here, this is inductive work at this moment, is a combination of variables to explain the Omicron policy response, the level of public support for government policies in previous phases and trust in government, continuing level of social cohesion, whether we find continuing or decreasing social cohesion with more divisions, the level of economic and social pain and the lobbying and by economic and social groups, and the vaccine situation. So all those variables interact in leading to the type of response during Omicron. So in terms of outcomes, what's noteworthy here is we start to see Korea and Australia, between December and January, they almost have a doubling of deaths per million. And that's cumulative over the entire period, while Japan is flat. Singapore has had an increase on the Delta, but not as much now. And then we find relatively high case counts in Singapore, Australia especially. But all those numbers, including Japan, are much lower than Europe. We find France at 5,294 per million, right? A 7-day smooth average. And then you find. So in terms of map, it's similar to previous maps, so no big change. So finally, Japan and Omicron, clearly the most obvious causality is the upper house and the Kishida political bind. But the deeper reasons, I'm arguing with Saya Soma here, is that there is high political sensitivity as the government got frustrated with the government inconsistency by relying too much on social response rather than government regulation that was effective. And there's all kind of bottlenecks and rigidities in the system that people are frustrated with. We also argue there's deeper social change and shifting values that lead many young Japanese, especially, to question traditional compliance with authority figures. And we link this to some recent data from the value survey. So people now expect more freedom from traditional group, family, and work structures that have been enforcing, in a way, through peer pressure, the response to COVID. And then we can measure, do you feel that the response by the country was good, in terms of COVID in general? That was done in June by Pew. We find that Japan has the worst outcome with, very high frustration, over 60%, and compared to the rest of East Asia. So Japan divergence for East Asia here. And it's even higher than the US, actually. We also find, if you ask, should there have been more restriction to COVID, and that was done in June 2021, Japan is the highest, followed by the US. And it's very different from the rest of East Asia, which is at the bottom. I'll skip this. I can speak more about the China situation, but I'll skip it now due to the lack of time. So I'll conclude again by saying we see very interesting divergence in policy outcomes. Key variables are the coordinating institutions and social cohesion, social trust. But Asian cases had weakness with vaccine. And interestingly enough, inequality and social anger have risen in cases like Korea and Japan, but not in the other East Asian cases. Thank you very much.
Thank you. That was an incredible presentation, truly comparative, with an amazing array of data across different measures up to the date, literally, of today, and a great application of concepts from social science thinking about trust and institutions. Really tremendous research you're doing here. I have a small question about your last comment on the vaccines, because we do think of the East Asia model often in the context of industrial policy targeting. And we know that China's industrial policy had targeted pharmaceuticals, and they did develop their own vaccine. And it's remarkable that Japan has a leading pharmaceutical industry, but did not really have a serious effort from the government for vaccine development. And I wonder if you have any ideas on that, since I know you also are very much at the crossroads of political economy. But before you answer my question, let's also turn over to one of our associates at the program on US-Japan relations, Chinami Iokibe, who is an associate and works in Japan for the Ministry of Health, Labor, and Welfare. While here at Harvard this year, she is doing research on labor market mobility and human capital formation in the digital transformation era. Chinami, please go ahead with your question.
Well, thank you for your exciting story. If the government changes the response strategy to the COVID-19, social understanding might be essential. Lately, New Zealand and the UK changed their strategy. So are there any communication tips to gain social approval? Thank you.
Yeah, thank you for both great questions. Thank you, Iokibe-san and Christina. So on the vaccine question, yeah, it's particularly striking, not just relative to China, but also Vietnam and Taiwan, right? Now, the Taiwan vaccine, Medigen, was done in partnership with an American firm, Novavax, but in the end, it's only representing 5% of the current vaccine distribution. So it was not as effective as Pfizer and the other one, and especially Moderna. And Vietnam, similarly, not as effective, but still it's amazing that they managed. In fact, Vietnam has an industrial strategy now to become a hub in all pharmaceutical and has signed contracts to manufacture Moderna in its own factories and all this. So in contrast, it's really striking. I was puzzled too, both for Japan and Korea, that despite the strong biotech and pharmaceutical base that they have, they were completely behind. They were in a race initially. There were some, when there was initially 130 vaccine development programs in the summer of 2020, there were a few out of Japan, but they didn't finish. They didn't succeed. And I think, so the response we heard from Kenji Shibuya was, number one, that due to legal lawsuits in the early 90s, there had been a discouragement of innovation, both and too much liability, both, I guess, for AIDS treatment, but also vaccine development. And so there had been a wrong incentive there. And then very, I guess he mentioned subsidies and lack of incentive, lack of competitiveness. So maybe it's a case, that's worth doing more research. And I hope to be able to do that. But it may be one case, we used to, when we studied industrial policy of Japan, there used to be really two track, right? And depending which track you looked at, it was either terrible or very good. So there were cases of success, cases where it was neutral, it didn't do very much. And, there were companies that were escaping entirely, like Toyota, no thank you, and they're doing great. And then there were cases of protection of inefficient clusters with lots of lobby groups and LDP triangles. And it could be one of those, right? But I guess it's a wake-up call to Japan, right? That this has become a very, very important battleground. I hope there will be a whole rethink here. Mm-hmm. Mm-hmm. Oh, and then to Iokibe-san. Yeah, so yes, social understanding is key, absolutely. And that's where the communication is critical, especially in democracies. And we have seen great examples, but they're not the UK. The better examples tend to have been, initially Merkel was very good. Of course, Jacinda Ardern in New Zealand with her very clear chat. The Prime Minister of Singapore, Lee Hsien Loong. In Korea, very good cases with the head of CDC, who became highly trusted. Even in my province, Bonnie Henry was very, very effective with regular briefings. In general, what we find from those cases were very compassionate, caring, and yet very precise and full of data and consistent. So when it's divided among many people saying inconsistent things, as we had in the US, that really loses everybody. When it's full of inconsistency over time because of lies, or that's the Boris Johnson problem, right? Who has lost all credibility now, saying one thing and doing the other thing. That's a problem, right? Yeah, but there's a lot to learn from this communication. There's also been the problem of dealing with social media misinformation. And so there's a whole bunch of study groups about this. There's one at Stanford, for example, and it's difficult, right? This is new. This is the first pandemic in the area of social media. What we find is there has to be a very, very deliberate, organized group to to play a positive role with a very consistent positive data, engaging the public with all kind of data, and not letting the system be overwhelmed by just misinformation, right? But it's tough. And New Zealand has not yet reopened, right? There is actually, as we speak, a scandal because of this pregnant woman, the report in UAE, who cannot deliver a baby in UAE and cannot return to New Zealand. So she says the Taliban invited her to deliver in Afghanistan out of compassion. But today the New Zealand government is saying, well, do something for her. But currently, even citizens can't return. That's the rare case, right? Citizens cannot return because they have to be quarantined in an army base, and then there's not enough army base spots, so many can't go. But on communication, the Prime Minister has been very, very effective.
We have a great question in the chat from Alan Alexandrov, who I think, observing the many differences that you have highlighted in your presentation, asks, it would seem there is no East Asian model.
Well, there was an East Asian model in 2020, but without Japan. Japan had only the social cohesion part, but not the institutional part. And then that model fragmented in 2021 into separate directions, right? Even though they still rely on some of the institutional tools. And in some cases, the social cohesion has frayed. That's why, for example, Korea knows the government has run out of bandwidth to demand extremely strong reaction. The public is now tired of it, and is an election, so they don't have space, neither political space, no social bandwidth. But in others, like I guess New Zealand still has the support, and that's Oceania. But Taiwan in general, that's the case that's robust in its model, right? So the quintessential East Asian model is now Taiwan, and then to some extent, of course, China, but with a more authoritarian flavor to it, right? Harsher method, and actually, as far as we know, anecdotally, they still have social support, however, for the harsh model, but they also have political enforcement tools. Mm-hmm.
We have another question in the chat, but I'd also invite people to raise hand if they'd like to ask directly. But for now, Mircel Dogrol asks about the correlation between development levels and strict policies.
Yeah, very interesting. In 2020, and that was a surprise, is that there was no good correlation between economic development and policies, strict or not, and outcomes, right? In a way, that was the surprise, that Vietnam, Mongolia, and Thailand could do better than the US and Europe. And it became praised by WHO. Uruguay was also praised, by the way, interestingly enough. And Uruguay is the country with the highest social cohesion in South America, and least inequality. So that was the surprise. But in 2021, that ran out of bandwidth because Delta was, there's an issue of length, how long you can hold the economy when you don't have a central bank that can print so much money that you can add 20% to your debt over GDP. And that was Vietnam, Thailand, Mongolia. They can't do it. And then people are really literally under so much duress that you can't keep it going too long, right? So by 2021, the link between economic development and outcomes started to come back. So the link may be how long you can endure, the resilience you can have with a very harsh method that can shut down your economy. now the one that's again the puzzle here is Taiwan, right, and China. But Taiwan has managed to keep well, they keep strong border control and contact tracing and all this with limited stringency. That is, they have opening of society and economy, and the economy was not hurt. In fact, their economy did great. 4%, well, 2.9 and then 4% last year, and etc. But they are benefiting now from geopolitical forces that are moving a lot of factories back to Taiwan and all this. So there is an interesting whiplash effect here. So it's a complex causality essentially, but it is also the poorest countries, Africa, where outcomes have been better than expected. So of course the data is undermeasured in all this, but it's still a surprise that Africa has done a lot better across the continent, with the exception being South Africa, which has done the worst in the continent. But they did some institutional innovation, like a unified African CDC, unifying a lot of the actions, and then a common PPE purchase platform and the like. Now, however, over time, it will be hard to sustain those early boost farm innovations in institutions.
It's interesting, the zero COVID policy and very stringent rules that you highlighted are still present a little bit in Taiwan, Korea, Vietnam. Is that because of their proximity and dependence on China that they are encouraged to follow a similar policy? And in return, have they been able to keep up interdependence with China that also supports their economic outcomes? To what extent are these interdependent decisions?
So not Korea, right? Korea, since December, has really opened up more to the living with COVID, like Singapore. So there's friction in the transactions, but it's very different from students can go to Korea. They can't go to Japan now, right? And then Vietnam is interesting. They still want to do a zero COVID, but they were not fully able because of all the trade links. So they're in between. They haven't disavowed it, but in practice, they have let the openness of trade go through. But in response to your question, for Taiwan and New Zealand, those who really keep it, and to some extent Vietnam, I would argue it's not linked to China. It's linked, I mean, the only link is more for Taiwan, a bit of competition in legitimacy, right? That is, Taiwan wants to demonstrate that you can be, as effective, or you can be extremely effective and set the frontier within a democratic system. And they have succeeded, right? But apart from that, it's more related to the expectation of the public and the social expectations. So they do it mostly for themselves. And in any case, both China and Taiwan put a lot of frictions on the border. So it's not like they keep a lot of movement, right? I haven't checked the numbers, but the movements are very difficult. And the same with Vietnam, right? Vietnam, the first thing they did back in January 2020 was shut down the border to China first. they were actually protecting against China #1, right? And they have, however, they have had to keep a degree of openness to supply chains coming from China and then output supply chain with the West, right? They are now a hub between the intermediate inputs come from China and the exports go to the West. So Vietnam cannot shut down and keep its hub position. So the answer, therefore, to your question is mostly a no, because of the variation, but there is maybe a bit of competition for legitimacy going on, including Vietnam, right?
Do we have other questions?
There is from Shin. Should I read the question from Shin or?
Oh, I didn't see from Shin. Sorry, Shin, you should raise your hand. Let's see. Could you elaborate on how you measure? Yes, and so Shin Fujihira's question asks Yves to elaborate on measuring social cohesion and what does it mean to have generalized trust towards the state?
All right, so trust itself, so it's a complex topic, this entire, and I'm not a sociologist, but when I was reading this literature, it's like, whoa, it opened up many sub-bucks and sub-drawers, and many people know a lot about this. But roughly, my simplification of literature, there's really two types of trust. There's social, horizontal trust. So it's horizontal with neighbors within society, and it's vertical with the government. And I looked in depth at the data. And even though the WHO, for example, emphasized the vertical one, they made statements and saying, we have to learn from Asia. They have this vertical trust, which helps them. Blah, blah, blah. In practice, the relationship is stronger with the horizontal trust. And for example, you have low data on vertical trust for Japan and Korea. So that was part of what I was bumping into here. And then and then you have places that did well, where it's not that high either, like the Nordics or whatever. So it's the social trust that is the trust your neighbor and the willingness to do something for your neighbor, for the society, the social cohesion, whether it's because you love your neighbor or because there is a bit of social peer pressure or there is, a neighborhood peer pressure. So it can be multiple triggers here. That seems to be, and it's worth doing much more quantitative work over the coming years. That seems to be the primary driver. But I did look, as you noticed today, I also look at the vertical trust because it's been so talked about. Mm-hmm. Mm-hmm.
Kristen Vicasi, Associate with the Program on U.S.-Japan Relations and Professor at University of Maine.
Hi, thank you so much for this great talk. It's been super interesting. I was wondering, and I really liked how you talked about looking at this as a moving target, right? And how everything is evolving very quickly. And so I was wondering, I was going to ask you to speculate forward a little bit. And when do you think we will be able to look back and evaluate first, like what sort of, from when the pandemic ends, how long after the pandemic ends will we need to do, and what are the indicators that you personally, having done so much research, will look at to say this country did well, these were good decisions, these institutions failed, we should reform them? Thank you so much.
Yeah, it's a great question. And, I was discussing this back and forth with the publisher, the editors, the three editors of my series. It's like, they thought it was really important to have something done quickly, but yeah, it's a huge headache when the numbers keep evolving. So, yeah, and as you can see, the solution I found is to break it into phases. And so we can say, there is phase one, there was phase one, and we can evaluate that phase. And then we look at other phases. But you're right that, we're not done, and there's going to be very changing evaluation over time. So eventually, well, when we can evaluate is essentially you want a year or two after the end of COVID. So roughly, right? And so that you can get the data in. And of course, COVID has to end first. And so we're going to get further phases. And I would use the same four kind of evaluate, indicator boxes I mentioned, right? Some health outcomes. So we'll look at mortality and, hospital, but mortality is essentially the big one, right? And then we'll look at economic outcome, and then we'll look at social impact and social outcomes. And then even the question separate box on freedom, whether because it's something you value politically, but that final box is also the political box. So that's the difficult one. That is, what you can expect is there is so much, the fire has been stoked to such an effect that some countries will have government fall. There's going to be more and more protests in some countries. It's the combination of restrictions on freedom that trigger identity question and all this, with social and economic impact, with inequality. Because one of the most shocking thing is that, you can have the wealthiest people in the planet double their wealth while so many fell behind in relative terms, right? So that we're not done with that. That is explosive. And that was accelerated by digitalization under COVID. And so, for example, we'll look back, the US case is not fully assessed yet, right? A lot will depend on the next elections and whether, of course, some of it predated COVID, but COVID has stoked the fire. And so, case like US and there'll be many other, Brazil and all this will come back and evaluate how, how politically and socially the country survived the crisis, right? And that story is not written yet. So for some, we know, a simpler way, for Taiwan, to some extent, we know, right, there's quite a stable outcome and some social political outcome. But for many others, even China, there's still unknown factors there, where it will go, because they don't yet have an exit option. So they're not in an equilibrium point yet. And so at some point, reality will burst through, right? You're going to have to either open up and have people suffer, on the health side, or you can't open up, but the economy will suffer. I mean, there's not a solution yet for the China conundrum, the exit from COVID. So, yeah, so some trajectories will take time and some we can see, but.
What about Japan's public, and what metric do you think they are evaluating the government by? Because you show these remarkable figures that reveal Japan has had relatively good outcomes on the metric of mortality, and yet is at the very critical level in terms of public evaluation. What do you
so
think
that's
the Japanese public thinks matters for evaluating COVID policy?
So that was my puzzle this year. As soon as the Pew data came out, I was talking with all my Japanese students. It's like, what's this paradox here? Look, Japan is doing pretty good. So what's the matter? Why is the public so mad, right? And it's even more so that I have this piece coming out from East Asia Forum with Saya Soma, maybe today or tomorrow. And one of the reviewers was presumably Japanese and say, look, all this comparative data is all and well, but the public doesn't care. They don't give a damn. They don't look at them even. What they care is the numbers are going up, and this is not acceptable by Japanese standards or based on expectations. Either it's a level of expectation from the government that's higher, they think it can be solved, or it's the sequence that, because then they say, oh, things are so bad, the people dying, and why did we have the Olympics? Why did we delay having tests and the PP? Then they look back and they're critical about what happened. But somehow, maybe, it will take a while to fully understand. Maybe we need Andrew Gordon here. Maybe there's a historical legacy here from previous pandemics and response to after Spanish flu, whatever. Somehow there is definitely a psychological component that the bar that the Japanese public has is much lower than in many places. And it's fascinating.
And maybe rivalry. On the mortality indicator, they are behind China, and so on that dimension.
Yeah, I don't know if they look at it, but,
We have time for one last question, very briefly though. Alan Alexandrov, if you wanted to ask your question, and also I'd highlight Kristen Bacasey's follow-up about the possibility that the economic outcomes for growth might also be important to consider.
Absolutely, lots of data, and I know Yves is always really good about that. And clearly there are the objective measures, right, that you talk about, mortality, et cetera. But isn't the problem that you've got an evolving public policy box? That is, public policy solutions have evolved and they change over time, so that, urging the lockdown becomes, no, we have to live with it. So how do you deal with that, intermediate box that keeps evolving on you?
Yeah, thank you, Alan. This is, as usual, great question from Alan. Good friend from Toronto, University of Toronto. Yeah, it's tough. It's frustrating for social scientists, right? If you have either an independent variable or dependent variable that keeps evolving. I guess the only strategy we have is to break it into sub boxes, right? Break it into, and we do find, I think by and large, that strategy still works. For most countries, you can break it into phases. And then you could see those who have consistency across phases and those who don't, right? And those who oscillate between very different things. And some are very stable, right? So yeah, that's all I can say, but this is a challenge, right? We love, and those things are interactive with each other too. They're not independent. So that is at time T3, the policy response is not just dependent on independent variables like, institutional tools and social trust. They're also dependent on what happened at T2 and the social response to T2, and also to comparisons with other countries. And then other variables like economic factors and that come in, right? Intervening variables. So it's very complex to quantify. If there is someone who wants to work with me on quantifying, very be interested. But this is complex. I can see very complex. Mm-hmm.
Well, thank you for leading us through this complex process. It's really fantastic to have you share your insights with a comparative perspective, both looking at this remarkable response in East Asia, where there's some similarity of better than average outcomes and social cohesion. At the same time, you've obviously helped us see where there are important differences. And I'm very glad to know you're continuing this research, and we will check back in for the next article, op-ed, and book. And good luck in your future research. Thanks so much for joining us. And thank you all to the audience for participation, and Shinju Fujihira and the Program of US-Japan Relations staff.
Thank you, Christina and Shin. Thank you for having me. And Susan, I see Susan.